For any baby at the age of 3, parents often face difficult times to control them, as at this point they are very active, moving around all the time, trying to pick a few things to discover for themselves. But the case is different for 3-year-old Tendo Walter, who cannot move, crawl, walk, or even sit upright after being born with a spinal defect.
Tasobola kuyimirira ate era tasobola kutambula kuba kuno okugulu okumu kunafu.
Tendo's mother, Rose Sanyu, says although her son can talk and eat normally, it's hard to detect whether he's stabilizing or not, as each day a new complication emerges.
Yalwala era batugamba abasawo tulina kigumira kuba buli kirwadde ekiba kizze kimukwata.
Baby Tendo's defect is said to have been noticed before birth by the doctors, who advised the mother to undergo an operation in order to have the baby safely.
Bone bangamba nsindike naye nga kyali tekisoboka ng'omwana atudde. Kati bwanasindika esooka kuleeta kino Spinal Defect.
Although most mothers are seen happy after having their babies, Sanyu curses the day she first saw her baby, and more so the pain that the baby goes through day by day.
Ngenda nendaba nga abaana bazannya kati nga noona aba ayagala agenda azannya ne banne naye nga tasobola.
According to Dr. Joel Kiriabwire, a neurologist at Mulago Hospital, the baby needs thorough examination, as his problem could be as well related to feeding.
I know from what I've been told that this child has been feeling unwell, been sickly for a long period of time. And those two might be where this problem is coming from. So if she could seek the opinion of an ENT and an eye doctor, I think it would help.
Baby Tendo continues with his daily pain and the fact that his legs are not of the same size, with the right leg bigger than the left with no nails. Dr. Kiriabwire says his conditions require a team of doctors, as even his urine is uncontrollable.
When you have muscles which don't have a nerve supply, they tend to become smaller and what we call in medicine atrophying. So they tend to atrophy. And I think the nervous supply to the left leg is very likely to be affected.
Baby Tendo's spina bifida was operated on 7 days after birth at Mulago Hospital, but now the mother's major concern is that he's supposed to get complete recovery before it's too late, as the doctors who operated him gave a deadline of before 3 years.
Tasiba pupu, tasiba susu. Kati dokita ne batugamba kyetaagisa miliyoni 7.
This child had an infection in the urine system. One of the problems with spina bifida is because the way the urine is being passed is abnormal. The bacteria tend to get a good healthy ground to grow.
Tendo's case is one out of many where most mothers end up abandoning their children after learning that they have deformities that at times are believed to be untreatable given the kind of complications. Zamzam Siraj, WBS News in Kampala.